What we're going to look at today is the SI joint, and I've already had her walk. I already know that she's long leg on the right, short leg on the left, and from what I see with the way she's gating, you can tell that she's rotated on the left, innominate. She's rotated anteriorly, so she's got a drop on the ASIS. We're also going to check her hip, which previously has been noted to have a anterior and internal rotation moment. So the important part of today is we're going to do a couple of assessments to confirm what I saw in her standing and her walking. So what I see here is when I go on the ASIS, you can see that there's a drop. It's not significant, but it's noteworthy. All right. Now, she's also got a couple of other comorbidities that we don't need to discuss here, but the long and the short of it is she's rotated on the pelvis. So we already know this confirms this helps to confirm long leg, short leg, and it's not a big drop, but it's notable. Okay. Now my cameraman's going to kind of pull back, so go down here to the foot. And here's something else that we see on her today, and she's not typically this tight. Okay, go up into straight leg raise and has a tight. Okay, she's not usually that tight. Same on the right, you can see the big difference. Okay, so she's about 80-85 on the left, and about 90 to 95 on the right, give or take. Okay, go ahead and turn over for me, please. Now the other thing is, and I'm going to look at the good side right now. You can stay where you are. If I go right here, do you have any tenderness?
Not much.
Okay, so Fortin's finger point, that point that you push right here that correlates to the sacroiliac joint, which if she has a hot spot, sometimes on the contralateral or non-affected side, it's because of compensation. So Fortin's finger point will often be hot and is a clear indicator for an anterior rotation. Go over here. Tender?
Mm-hmm.
So confirms long leg, short leg. So short leg on the left, long leg, short leg. Again, short leg on the left. And then the anterior rotation of the pelvis, which means that she has a hot spot right here. And we can get into the musculature later. Piriformis is now going to be up and on and a little bit more taut, and this will also affect glute med and a little bit of glute max. So we know she's hot here. Okay, now here's what we're going to do today. So let me get my chair, and here's the setup for this. In this position, I'm going to pull her down a little bit. Have your patient become completely relaxed. What you're going to do, so I'm going to work on a long leg manipulation in just a moment. But when you're taking out the creep, you watch all the way up, and then the way it goes across and up into this contralateral distal shoulder blade. What you should see is, because of the way the musculature and the fascia are working, you can at times see her relaxing and the pull all the way up into here. So the setup is this. Patient's prone, relaxed. And one of the contraindications would be pregnancy, probably past 4 months. If the patient says that they're pregnant but they're still laying on their stomach, then they're fine to do this. Otherwise, you would do this supine. The other thing is labral repairs. You want to make sure that they've been cleared by the doctor before you try to do this. Otherwise, you do it in a sideline position and it doesn't have the same efficacy. So here's the setup. Go ahead, grab well above the ankles, internally rotate, and pull. And you can see that creep coming out. Take a big step back, Seth, so that they can see. So when I do this, you'll see creep coming out that comes all the way up to that right shoulder blade. I'm taking the creep out, and my cameraman's going to come behind me so you can see what it looks like behind me, because this is the angle that I see it, so you should see it as well. And take that creep out. Now, what we're going to do, we've taken the creep out. She's going to relax completely. Take a nice deep breath and relax. Okay, good. Now, go ahead and we go into Fortin's finger point. Any pain?
No.
Roll over onto your back. Okay, take a step back, please. And straight leg raise on the right side has actually increased nicely. On the left, equal. Okay, now if we look at ASIS position, it's absolutely equal. And that's how I do the long leg manipulation for SI joint. That's my go-to. Again, if somebody were pregnant, I would keep them positioned on their back, and again, internally rotate and try and stay down. Same thing, and do that manipulation that way. We're not going to do it twice.